last 30 years, probably, the survival of patients, the children with cancer, has increased from 40% in the middle of the 20th century, science at 80% nowadays. This spectacular evolution is based in several reasons, but one of them probably is focused in the research in the molecular biology in the field of pediatric cancer. For this reason, our team, for many years, worked in several aspects related with molecular biology in pediatric cancer. One of them is molecular biology, is to make a better diagnosis from the solid tumors in children with molecular biology in neuroblastoma, in soft tissue sarcoma, in retinoblastoma, etc. The second is work in one important aspect, focus in the minimal disseminated disease. Is all patients are studied after treatment with expression of different genes in peripheral blood and bone marrow for detect the probably presence of tumoral cells in these both elements, the study of the minimal disseminated disease. And the third line, important line today, is work in the aspect focusing to try discover a new lines for the treatment of pediatric tumors. Basically, focusing to the inhibition of the different pathways, notch way or hedgehog way, the possibility to find a stem cell cancer in the soft tissue sarcoma to design a new aspects for the treatment. And then, now in this moment, one of the most exciting lines of work in our lab is to study all the aspects related with the microRNA. That probably is the pathology in this aspect is related with the worse evolution of the tumor at the presence of the metastasis in the different tumors. Our team also works in aspects related in hematological problems, and one of the most important projects at the moment is to treat the patients with Fanconi anemia, and now we are involved in an international program for gene therapy in this type of patients. The patient, a high percentage of patients with Fanconi anemia developed in their life, developed the probability of the myeloblastic leukemia or other hematological problems. The main aim of this project is to give opportunity for these patients across the gene therapy to cure their disease. In the last year, probably the most important project, all of them related with previous works, are four themes. One of them, the first, is the work's focus in the inhibition of the VHIR notch in the rhabdomyosarcoma and other soft tissue sarcomas, with the objective to find a new ways for the treatment of these patients. The second project this project was started in the last year, and probably the research continues for 2 or 3 more years, is based in the cancer stem cells in soft tissue sarcoma. Both projects in the last year won different grants in the Spanish and Catalan government. Today, the survival rate of patients with cancer is around 80% in developing countries, but it's very important to say that this is not the 100%. No? It needs to cure more, 20% more. It's difficult to accept now that in the world exists any disease that the survival is only in children is only 80%. No? We need to research in different aspects in the future, which in the main objective of these studies, probably in the future, every year, every decade, every time, reduce the rate, reduce this 20% of patients who die of the cancer.